So thank you for staying.
You're welcome.
You guys really, really care about ethics, so that's why you're here.
We're the only one with mental illness who are interested.
Or maybe you're a little worried about,
I want to find out how I can lock away.
This may happen to me.
We want to find out how to lock away Grandma. Okay, go ahead.
All right. So a little background. Mental illness is very common in the United States. About 1 in 6 adults has a diagnosable mental illness every year. And mental illness can cause a lot of different symptoms. There's a lot of different kinds of mental illness. But there are some things that might cause particular harm to an individual or to others. So suicidal ideation is very common in mood disorders. And schizophrenia, bipolar disorder, some personality disorders can cause psychosis, which is a loss of contact with reality. So an individual doesn't know what's real and what's not real, and this can cause them to act violently against others. So mental illness is often associated with poor outcomes. There's high rates of mental illness in homeless populations. Mental illness is very highly correlated with substance use and poverty, low education, all the things that we would consider socioeconomic outcomes that we want to avoid, if possible. So historically, all admissions to psychiatric facilities were involuntary. If someone thought you were crazy, they could just say, hey, this guy's kind of crazy, and you can get locked up in a psychiatric facility where really you would receive little to no treatment. So in the 1960s, people started to say this is kind of a problem. These people's rights aren't being respected at all. So we started this process of deinstitutionalization in the 60s, where individuals from mental institutions were shifted, were starting released from the institution, sent into the community, and sure. All right. So moved to the community. Community-based treatment options became more prevalent. But there are still processes for involuntary commitment in all of the states of the United States when a person is considered a danger to themselves or others. So in order to be involuntarily committed, an individual must be a danger to themselves or others. They also must be considered incompetent. So you are legally considered competent until you are legally considered incompetent. So it's a legal definition, but Turunen explains it as you have to be able to understand information as relevant to your situation, to reason with this information, and to make and express a choice. So as far as this goes with mental illness, you have to understand treatment options. You have to be able to reason and make a rational choice about treatment options and express that choice. So involuntary commitment is pretty controversial. One example of how sort of people can frame the debate is what they call it. So there are a lot of different terms for it in the literature. Involuntary commitment, civil commitment sounds kind of fancy and bureaucratic. Assisted treatment sounds quite nice and helpful, and coercive treatment sounds pretty nasty. They're all names for the same thing. So in Maryland, this is pretty standard as far as involuntary commitment procedures go. An individual can be committed by a mental health worker, a physician, a psychologist, a social worker, or a nurse practitioner by being taken to a hospital for 30 hours. They can also be committed through a judge declaring them legally incompetent. And it's possible to expand the commitment period to 10 days. So involuntary commitment is a short-term crisis intervention measure for someone who is considered to have a mental illness, to need inpatient care for treatment, to present a danger to themselves or to others, to be unable or unwilling to be admitted voluntarily, and if there are no less restrictive options for treating this person. So just to give you a little background about one case study of someone in terms of mental illness and involuntary commitment. Mike was a senior in college in New York City when he called his father, Pete, and told him that he had taken 5 homeless men to McDonald's for dinner, His father took him to a psychiatrist who prescribed him medication, which seemed to help with his mood swings and his strange thoughts. So he was good for a while, but a few months later, he spent 5 days wandering the street. He started to have paranoid thoughts. He thought he was getting secret messages from an Oliver Stone movie. He thought a friend of his was in danger, and he had stopped taking his medication because he thought he was doing fine. So Pete took Mike to the ER. He was given an antipsychotic. He agreed to hospitalization, and he was diagnosed with bipolar disorder. He was released 4 days later when his insurance company started to put pressure on his physician. A few days later, he went out for a drive. He couldn't tell if he was asleep or awake, so he closed his eyes and crashed into a parked car. He was voluntarily checked into the hospital again. He was there for a week, and for a while he was stable. He graduated college, but he went off his meds again. Now he believes medication is poison, and his father takes him again to the ER. Mike refuses treatment, and the doctor talks to him. He says, "Are you going to hurt yourself?" Mike says no. He says, "Are you going to hurt anyone else?" Mike says no. So the doctor says there's nothing we can do, and he lets him go. 2 days later, Mike breaks into a stranger's house. He causes extensive property damage. He takes a bubble bath in the tub. It takes a canine unit and 5 police officers to subdue him. So Pete says we need to get him involuntarily committed to keep him from going to jail. So he lies to the psychiatric social worker and says Mike threatened to kill him. So Mike is taken to the hospital and he's held there, although he's not given any treatment. And Pete has 48 hours to convince a judge that Mike is incompetent and a danger and should be involuntarily hospitalized. So just really quickly, how many of you think that Mike should be involuntarily committed to a hospital at this point? Pretty much everyone. Okay, no one thinks Mike should go to jail. All right, well, that's good. Okay, so we'll give Jess and Joanna a chance to change your minds about that. And these are the ethical issues that we're going to be talking about.
All right, so the kind of big issue around this is this being a paternalistic kind of thing going on, and 3 assumptions we made to justify paternalism for the situation is incompetence, dangerousness, and non-adherence are impairment. And so you can see for incompetence, is when mentally ill individuals cannot make rational decisions. For dangerousness is mentally ill individuals are just considered dangerous, and that's where we consider coercion to take place so that we can protect individuals in public impairment. And then the impairment is the mentally ill cannot follow treatment protocol. And so when you look up these words in the definition, incompetence is a person not of sound mind or mentally impaired, unable to make decisions for himself or herself. And then danger is the exposure of liability to injury, pain, harm, or loss, the threat of adverse events. And then impairment is a medical condition that leads to disability. So the way I kind of came up to put all of this together is you have somebody who's impaired, so they have a medical condition which leads to their incompetence, so their inability to make a clear decision, and then that could lead them to danger in society, lead them to be a danger in society. And so this brings us back to the harm principle. Going back, the only purpose for which power can be rightly exercised over any member of a civilized community against his will is to prevent harms to others. And so the important part for this case is that it's to prevent harm to others. So you have these individuals in society who are considered to be dangerous. And so there's the liability to that harm. And then the threat to society for adverse effects. So these 3, suicide, the manic woman, and the schizophrenic, these are 3 examples of situations where you can have somebody who can be a danger or harm to society. So for the suicidal person, they become a harm or burden to society because if they accomplish their goal of suicide, then the family is left with the burden, maybe financially or just the emotions that are left over from that person taking their own life. And then you have a manic woman who is someone who just thinks that she's indestructible and she's just erratic about her thinking, and so she thinks it's fully okay for her to get in a car and drive around, but she's basically like driving all over the place unsafely, making it an unsafe environment for all the other people on the road. And then you have last this schizophrenic person who is having delusions, hallucinations, and then within these delusions or hallucinations, they're hearing these voices that are telling them to perform harmful acts, and these are harmful acts towards others. And then that's how they become a danger to society. All right. So then you have the ethical principles. And just back to the harm principle, the important thing to know is that harm is prevented to others in that there is a burden to take care of those that may be suffering from mental illness if they cannot be involuntarily committed to a facility. In the case of someone who may attempt suicide, there's a burden left on the family, emotionally and possibly financial, as I stated before. All right. So then ethical and legal principles that we have are beneficence and non-maleficence, which we all know are the services that will benefit the patient, and then the do not harm. And kind of the approach that I took about this is that you are doing harm to the person if you don't provide them services that they need in order to be healthy. And then you have your state's interests, which is the parent of the country. Basically, it is the country's responsibility to take care of the members of society. And so if they have to use paternalistic actions in order to take care of that society, then it's justified. And then I think it's the same thing for the police power. All right, and so cases to support paternalism. Studies have shown that coercive intervention lowers the possibility of readmission in the long term, and then in 85 to 95% of suicide attempts that have failed, those people are still alive 15 years later.
Okay, so I'm going to be putting several things on the table that are against involuntary commitment. The first is this notion of incompetence, and I'm going to argue that mentally ill patients don't have a lower comprehension of medical information than other medical patients. Think of your patients who are in a state of delirium. Think of your patients that are mentally challenged. Think of those type of patients. Do they really have a lower comprehension than a mentally ill person? Just some evidence to support that. There was a study conducted by Committment et al. In 1998 and Wershing et al. And they looked at the consenting abilities of mentally ill individuals. And they found that the mentally ill individuals, and these are individuals that had schizophrenia, that they didn't show any lower levels of comprehension than other medical patients when given equal information. So it was a very interesting study where they started the schizophrenic patients on Haldol, and they had them, they read the informed consent to them, and they had them take a questionnaire telling them what they asked them during the informed consent, and they had them take this questionnaire 2 or 3 times until they scored 100% on it, and then they asked them again 7 days later, and they found that over 80% of the mentally ill patients had still remembered what they were told about the informed consent. And also the idea of paternalism, that you're helping the mentally ill person. And actually, there are studies that have found that involuntary commitment worsens psychosocial functions, symptoms of mental disorders, and results in a low use of community resources, like a mentally ill person seeking outpatient treatment after their discharge. Also, if you look at more specific measures, there was a study that opposed paternalism that caused that due to involuntary hospitalization or experiences of high PC, and PC is an acronym for, I believe, perceived coercion. So, and they saw that they looked at two measures. They looked at the GAF, which is the Global Assessment Functioning, and this is scored from 0 to 100, and it looks at social, occupational, and psychological functioning of adults. And the other measure they looked at was the BPRS, which is the Brief Psychiatric Rating Scale, which is basically a list of 24 symptoms, and the clinician checks off what symptoms the mentally ill person is displaying, like anxiety or having clouded thoughts. And then also, there's some studies suggest that there's no positive correlation between coercion and treatment adherence. So this study by Rain et al. In 2003, they found that patients that felt that they had a high level of being coerced to take their medications, and mentally ill patients that didn't feel like they were being coerced to take their medications, after 11 months, they found that both patients were still adhering to their treatment. So this idea of beneficence and malfeasance, that we're helping the mentally ill patient and we're not doing any harm. As you know, physicians take an oath, do no harm. But there are cases, in fact, where coercive treatment causes more harm than good. Just a real life case is the case of Joyce Brown. I don't know if you all are familiar with her, but she was a 40-year-old African American woman with severe persistent mental illness. This is in the state of New York. She was chosen by Mayor Ed Tess, a case for Project Help 2. So basically they were taking mentally ill homeless people off the streets and, thinking of the idea of helping them, they brought them into hospitals for involuntary commitment to hospital for psychiatric care. So this is a woman that she fought against this. She fought against having to go into a hospital involuntarily. And she partnered with the American Civil Liberties Union in motioning a court case against the involuntary commitment of the homeless. And after her fight, it was kind of a back and forth type of fight where at first they told her that she won the case and then they went back and took back what they had adjourned. So eventually she won the case, but it was a kind of a sad end to the story that she was just discharged back into the streets with no type of resources, and she was eventually rehospitalized several times. Now we have this idea in our head of mentally ill individuals being very dangerous, but in fact there's no concrete evidence that mentally ill have higher crime rates, and you can't predict violence. We kind of stereotype the mentally ill as being very violent and unpredictable. Binder in 1999 found that most mentally ill individuals that are violent, they either have a history of violence, they have a treatment of noncompliance of being off their medications, and they have comorbid substance abuse issues. And usually the victims of mentally ill patients are the caretakers of these patients. Now also the idea of impairment, of mentally ill individuals being impaired, we see that there's mixed evidence on that. In the Cont, coercion causes one to lose self-confidence as an able-minded human being and impairs therapeutic relationships. You're coercing the person, taking away their autonomy, you're taking away their self-sufficiency, and then it results in an impaired therapeutic relationship. And also, it also severely disrupts any voluntary search for help, where you kind of feel, the person kind of feels debilitated and doesn't seek out resources on their own because they've been so disempowered. And then also, impairment also leads to decrease in psychosocial functions, symptoms of mental disorders, and use of community service. And we saw the same argument about paternalism, where the person actually became worse as a result of involuntary commitment. So in summary, after we talked about all this, we can see that involuntary commitment is a complex issue involving the harm principle, paternalism, beneficence, non-beneficence, and veracity. And it's going to be an ongoing discussion. And that ongoing discussion is going to be necessary in order to prevent violence while preserving the rights of individuals with mental illness.
Just to touch on what Maryland is doing after Newtown and gun violence has sort of come into the news a little bit more. People are starting to look at our involuntary commitment laws and say maybe we need looser laws. Maybe that would help to prevent some of these tragedies. Maybe relying on when the person is just so dangerous and can be proven to be dangerous to themselves or others is not early enough. So in Maryland, in the House of Representatives right now, there's this Gravely Disabled Act where a person can be involuntarily committed if they cannot provide for their own basic needs, such as food, clothing, shelter. So this sort of goes against the Supreme Court decision that a person cannot be involuntarily committed if they are dangerous to no one and can live safely in freedom. So it's just kind of the question of how safe is safe enough. If they're homeless, if they can't feed themselves or clothe themselves, are they safe in freedom? The Grave Disability Clause can be seen as an attempt to get someone help before it's too late. For example, in the case example of Mike, if his father hadn't lied and said, "He threatened me, I don't feel safe," he wouldn't have been able to get him involuntarily committed. And so this kind of Grave Disability Clause would be helpful in situations like that. And then just to touch on Mike one more time, luckily he decided to voluntarily check himself into the hospital, but because the owners of the house that he broke into filed a complaint, he was charged with 2 felonies. If he was a convicted felon, he wouldn't have been able to vote, drive, or get a professional license. Obviously, his life would have been severely disrupted, even if he was able to get treatment and get out of his psychiatric crisis state. So luckily, he was able to strike a plea bargain. He was convicted of 2 misdemeanors. He had a lot of trouble getting a job, but he finally did and found a new medication and is doing all right. But this is the quote from the book. There was a chance Mike would never again be troubled by his disorder, but statistically there was a better chance that he would stop taking his medication at some point in the future because he would become convinced he no longer needed his pills and he would have a relapse. So this is a person with a ton of family support, a ton of resources, and still chronic and persistent mental illness can really severely affect his life. So you can imagine how it would be for a person with no family support and no resources trying to deal with this kind of thing. So thank you.
Okay, all right, very good.